In the story work with First Nations, Inuit, and Métis people, the care in community, the importance of families, and the importance of recognizing and supporting families as they care for a person who has had a diagnosis of cancer were identified as crucial aspects in the cancer journey. The doctors' and nurses' responses in the broker dialogue reveal an understanding of the key role families fulfill and how the supports to families should be improved. The Dialogue and Story Work Project used the broker dialogue methodology. This approach unleashed the power of sharing stories to help facilitate safe, meaningful, and respectful conversations between healthcare professionals and Indigenous communities. Cancer survivors, those still on their cancer journey, and caregivers came forward with the support of community champions to share their personal stories and talk about the challenges and barriers they experienced when transitioning through different levels of care. Healthcare professionals then watched the narratives and responded on video, giving their professional opinions and thoughts on the issues and concerns shared. The healthcare professionals' video responses were then brought back to participants to continue the dialogue. Participants had an opportunity to respond on video to the healthcare professionals, in turn closing the loop on the dialogue in a way that was supportive and meaningful to each participant.
I'll start off with the local first. Care after patients are return, or before they go to their treatment and after they return from their treatment. I've been advocating for a system that we could put in place around here for the past couple of years now, and I still would like to see it get done. I'd like to see someone who can put together a package for each individual patient before treatment, what they could expect, and then post-treatment care, whether it's ongoing chemo or just to get the patient strength back when they get home. We need to get this complete package done, because it's very important for not just for the patient but for the families that are also very worried about that individual. Because once you hear that diagnosis of cancer, doesn't matter what type it is. That's the other thing too. That's I would include in the package is a type of cancer. Because whenever somebody says cancer, too bad. Nobody seems to ask what type. Is it curable? What stage? Can it be treated? I think there's also a big need for people to be comforted by this information that you get beforehand.
And it pointed out that the medical field is a limited field in terms of understanding really what would help cancer. That made me feel much better, because it meant that I don't need to always depend on medical for what I need to do. So it gave me the encouragement to continue my quest for understanding for it about myself. I started reading. I started just looking up anything that would help. But I still longed for a place where I could go to be able to get the support and answers to my questions.
The support systems that we need in First Nations communities is the ability to be able to care for our loved ones and walk in that direction, knowing where we're going. Somebody has gone here before, and we all know that. It's the responsibilities that we have. But as First Nations, we need to do that and do it with our cultural competencies, with our ability to incorporate what we're doing. Our communities have had dreams of having circle of care when they come back from treatment, from chemo, and the weakened spirit and the blood transfusions and the tests and the chemo and the radiation.
These are people's homes for generations, and leaving home is a very, very big deal. And people want to be at home. They want to be sick at home. They want to die at home. They want to be with their family and friends and people that they've grown up with in a place that they've lived in since they were born. So I think knowing how important that connection to community is, but also realizing what people face and how we can support them to still be comfortable at home.
People are altered, Indigenous people are altered, or other people are altered when they leave cancer care. Their bodies have been altered, their psychology might have been altered, and their soul might have been altered by the experience. And that came through very strongly in the videos.
Yeah, as a caregiver, I recommend that you, like, self-care is very important. I know I keep stressing that. And the other thing is families. They need a lot of family support, because I was so glad that I had my family around me. Even though I was the main caregiver, my family was always there. I always talked to them before I did anything. I talked to them, and if there was any decisions to be made, we did it as a family, and for that I was so happy. Yeah, so. Make sure that they take care of themselves too. You tend to forget yourself when you're looking after somebody, and it will catch up to you. You will feel it in the end. Because I know families, they go through so much, and they need to take a break. They need to take care of themselves, and they need respite services. It's just, even for a couple of hours, I know it would help greatly.
It was just my wife that sort of held me together, because I was a mess, like, why me type of thing, And like, my wife's a strong person. Like, she's a registered nurse, and like she sort of pulled Evie and I through the bad stuff, and she's really quite calming.
I'm a very independent woman, I have been, and that was quite an adjustment for me to make, to have to depend on family. But they're so good with their unconditional love. They're there for me, like, right away. And my daughter-in-law and my son teaching me about unconditional love, unconditional support. I really am grateful for my family for being there with me, to walk with me, to journey with me in all of what I had to go through to get through the diagnosis, and to help me to understand how important it was for me to continue to have the positive attitude about my life and not to give up. Because there were some days that I wanted to. There were days, the dark days of my life.
And as a family, marrying into her family, my husband and I, we take the teachings that she's given us, and we give that back to our children, her grandchildren, and my grandchildren. She speaks about the circle of life. She speaks about the support system. That support system that we have for her was taught to us by her. So what we're giving to her is come full circle, and it's given back to her. And she still takes care of us.
My experience with Indigenous families is that people make choices as families. It's not just one person or the other. You might have a head of the family that people will turn to, but it is a family group discussion. And a lot of times, elders will listen to their children. So instead of it's the elder making the choice, they'll listen to their children and, well, what do my children want? You know, what does my daughter want? What does my son want? And they defer to them. So I think people are aware of that family dynamic.
How absolutely grounded cancer patients are during this difficult journey in their communities and in their families, and that we should respect that component, and we do. We do realize that our northern patients only come as a group of 5 or 6. We do realize that we often have to communicate with more than just one family member because of people's concern, and we encourage families to be here, and we constantly see a large number of people. We often have 5-6 people in our rooms when we interact, recognizing the importance that families and communities play in our Indigenous cancer patients' lives will help inform that to make that more of a welcoming environment.
Family is very important to Aboriginal patients, and I think because in communities, community members are looked at as extended family, and it's a very close-knit group, so we do tend to see, especially when they're admitted here, we do tend to see a lot of family members coming to the unit to visit and support each other. So it is nice to see.
I feel that it's definitely a good idea to have some family members coming with a patient to their visits, because also it provides the emotional support that we need at a time like that, but also it helps everybody to get the information. So again, it is so much and so overwhelming at the same time that having a couple of members present in the same room, they can basically remember more what is being shared, the information that is being provided. So that I think is very useful. And also sometimes for questions that someone might not think about, then family members might have also some of those questions. So it's definitely something I would strongly encourage for anybody.
We've all had that experience in the hospital where if somebody is sick, how an entire community will rally around that patient. It's amazing to see. We see it certainly when people are dying, but also when people are sick. You get grandkids and nieces and aunties and everybody coming to provide support to that. It's very interesting. It was interesting to hear the video of Lacey and how that wasn't happening when people were back home. You know, once they were in their community, how they weren't getting necessarily that same support.
I remember her crying to me and telling me like nobody goes to see her or visit her, and nobody understands like what she's going through. And you know, I think they were scared. Like her friends, they didn't know how to like deal with it because she had cancer, you know. I think they were scared to come visit. And
I mean, processes to improve the concerns that were raised. There are probably 2 areas that I would comment on based on those interviews. One of them being making sure that we're having some kind of support or counseling for patients right from start to finish of treatment and the follow-up, including for family members. I mean, part of it is the emotional experience that the patient is going through with their diagnosis, but also there are going to be the effect that the diagnosis has on other family members.
I would really want to say to them that my heart went out to them for the challenges that they faced. I heard in their stories the voices of a lot of patients I've seen. I understood very much the difficulty they had with dealing with distance and dealing with uncertainty and lack of communication. So I think they've expressed very well a lot of the concerns that we know already exist, and things that we're trying to address, but progress is perhaps not as fast as it could be. I think a lot of the patients and their families are extremely courageous in their attempts they make and the effort they put into to try and do everything they can to help the family member who's unwell. But I can see that sometimes they really get frustrated and sometimes they really feel at their wit's end.
Whenever the patient leaves the hospital, the aftercare and also what was I going to say? Patient discharge. There's really nothing to say that these people are going to be okay, and they don't know where to go. After they leave the hospital, they go home, and what happens there? Some communities have nurses to do the follow-ups, but the doctors never come out anyway. And then yet they have to go back to the city. And a lot of these people live a long, long ways. And that's my only concern is like the follow-up care. Eh? And I think there's something that's needed, down the line so that these people will have to fall back on, because there's really nothing out there that's going to help these patients.
Let's take care of the people. Let's stop taking care of cancer for a while and take care of the people. Look at the person. A lot of the time we're running behind cancer. We're running behind the sickness. We're running behind the illness. And what my mother-in-law wanted was for us to stand with her.
I think they all talked about how important it was to feel supported, and I think that's one thing we can do in addition to treatment, and even when there isn't a really great treatment, we can still stay there and be involved and guide them through the system and through whatever comes their way.
In the story work with First Nations, Inuit, and Métis people, the care in community, the importance of families, and the importance of recognizing and supporting families as they care for a person who has had a diagnosis of cancer were identified as crucial aspects in the cancer journey. The doctors' and nurses' responses in the broker dialogue reveal an understanding of the key role families fulfill and how the supports to families should be improved. From the story work, which issue stood out for you? Which issue stood out for you from the responses?